Hello, this is Dr. Jawad. Please subscribe to my channel for more up-to-date videos, and thanks for watching. Hello everyone, this is Dr. Jawad, and what I want to talk about in today's video, I want to talk about an organ. It's very important, it's very vital to the absorption of fat, fatty acids, the breakdown of fats, moods, headaches, constipation, basically how the digestive system works. And what I want to talk about this organ is the gall bladder. Okay, now the gallbladder, where's the gallbladder? The gallbladder sits right underneath your liver. Your liver is about 5 pounds in the upper right quadrant, and underneath it is the gallbladder. Now, one of the functions of the gallbladder is to store the bile that's produced in the liver. Okay, what it does is stores in this concentrated form. So as we eat fatty substances, okay, we go from the stomach to the small intestines, and the gallbladder actually secretes out bile to help break down the fats for absorption into the small intestines. And it's very important because we need those fats to help absorb with the fat-soluble vitamins. Vitamins A, D, E, and K. But right here, I just want to talk about the three most important ones, A, D, K. So you may be taking in extra amounts of vitamin A, you may be taking in extra amounts of vitamin D, or you may be taking in extra amounts of vitamin K, but nothing is happening. Okay, that's because your gallbladder is not functioning properly to secrete out the bile to help break down these fats for absorption. Or if you had your gallbladder removed, you will have these ailments because there's nothing helping breaking it down. Okay, so the fat-soluble vitamins, if you're low in vitamin A, okay, this is where you get night blindness, dry eyes, dry skin, okay, because one of the functions of vitamin A, again, it's a fat-soluble vitamin. Without the proper secretion of bile from the gallbladder, you're not absorbing these essential vitamins. Also, too, vitamin D3, okay, vitamin D3 is very important, and because it's involved with, again, if you have depression, or if you have chronic fatigue syndrome, or if you have flu-like symptoms, or if you have the flu, because vitamin D3 is actually a prohormone. Actually, vitamin A and vitamin D3 actually act as almost prohormones to the system, and that's why it's very beneficial. So you may have flu-like symptoms, which with the flu, this is where you get achy. This is where you get bone pain. Also, vitamin D3 has been used to actually help reduce high blood pressure, because one of the functions of vitamin D is to absorb the calcium into the bloodstream. Okay? You may have asthma. Again, asthma is it's a common condition with children, and the thing about asthma, which is interesting, asthma usually only occurs in the wintertime because this is where we have seasonal affective disorder because we don't go out in the sun. Now remember, we absorb a lot of our vitamin D levels through our skin. Okay, and it's manufactured to the active form in the kidneys. However, with kids who are not going out during the winter time, this is where you get asthma symptoms. Also, too, muscle cramps. Now, the purpose of vitamin D3 is for calcium absorption into the bloodstream. So if you have muscle cramps, that means that you have more calcium outside the cell and not coming into the blood. So this is where problems occur. Also, vitamin K2. Now, vitamin K2 is separate from vitamin K1. Vitamin K1 is involved with blood clotting, okay? So this is something totally different. Vitamin K2, what it is actually a calcium transporter. So when we take in calcium, vitamin D3 absorbs calcium into the bloodstream, and then vitamin K2 takes it from the bloodstream and deposits it where it should go in the bones and teeth. When you don't have enough vitamin K2, now K2, remember, it's a fat-soluble vitamin. So if something's wrong with your gallbladder and you're not breaking down those fatty acids once it gets in your small intestines, you're going to have reduced levels of vitamin K2. And this is where you get arthritis. This is where you get high blood pressure because calcium is floating all over the system. Now, calcium deposits in the endothelial lining of the arterial system and in the heart, because the hearts have very small arteries. This is where you get high blood pressure. Or maybe in the eyes, this is where you get cataracts, or maybe in the brain, this is where you get Alzheimer's. So again, fat-soluble vitamins, if you're not having if you have a poor functioning gallbladder, you're not absorbing these fat-soluble vitamins, even though if you're taking additional ones. Now again, the gallbladder also is attached to the liver, which has a dynamic function on the thyroid. Now the thyroid gland is a butterfly-shaped gland in your throat and produces 60% of the inactive form, transports to the liver, which gets converted to the active form of of T3. So it goes inactive T4 to active form of T3. And that's in the liver. So if you have a poor functioning gallbladder, it's going to toxify the liver, so it's going to have low conversion factor. Okay, also, bile acts as a lubricant for the digestive system. So if you're not producing enough bile in your system, this is where you get constipation, or you get bloating, burping, belching, or you get headaches, or right shoulder pain. Because the nerve is called referred pain. So if anything's wrong with the gallbladder, it will refer up to the right shoulder. And from the right shoulder, it will reflexively go into the muscles of the scalp to give headaches. Also, you don't feel satisfied after eating. Now, the reason why you don't feel satisfied after eating is because you're not digesting these you're not producing enough fatty acids to help with the satiation center in your brain. So what causes all this? One of the things is high levels of cortisol. Now, the high levels of cortisol, that's an adrenal response, okay? The adrenal glands are your stress glands that sit right on top of the kidneys. So when you have elevated levels of cortisol, what actually that does, it actually shuts down the bile system, the bile ducts. In addition to that, estrogens, okay? Estrogens will boggy up the liver, okay? Will slow down the process of the gallbladder, and this is where you get this is where you get symptoms when you're taking estrogen. Also, too, low fats. Now, the biggest thing is the low-fat diet. Now, again, we need fat. Our body strives on two things, that's proteins and fats. So when you're actually decreasing your fats, you're not absorbing the vitamins A, D, E, and K into the system. Also, too, soy protein isolates. Now, a lot of the diets are soy protein isolates, which is a cheap protein and it's very, very hard on the system. Also, too, junk food. Junk food will do it as well. So these are some of the causes that will toxify the gallbladder. So what to do about it? Okay, so one of the things I always instruct my patients is diet. First and foremost, diet. You want to reduce the level of sugar that you're taking in. Okay, sugar and the polyunsaturated fatty acids, because too much polyunsaturated fatty acids will actually slow down the gallbladder because you're taking in too much fat. The gallbladder cannot handle it, so it shuts down. So we can also take in cruciferous foods. This is your broccolis, this is your spinach, this is your cabbage. This will help clean out the gallbladder to make it function better. Also, too, take in additional amounts of vitamin D3 and K2. Those two combined will help improve the function of the gallbladder, which help improve the function of the immune system, which help improve the function of the digestive system. So vitamin D3 and K2. Also, too, DHA. This is part of that omega-3 fatty acid family. You have EPA and DHA. DHA is phenomenal for the brain. It's also good for memory. It decreases brain inflammation to improve its function. And also do bile salts, because bile, the thing about bile is really nice. Bile recycles itself. So if you're not producing enough bile because something's wrong with your gallbladder, then you have decreased recycling. Okay, so when you take in bile salts, they'll actually increase the production of bile to help break down all the fat for better vitamin absorption. So the gallbladder is a very important organ to have. Again, I always recommend don't get it removed. Watch the diet and improve your health through your diet. All right, hope you've enjoyed the video. Thank you very much.